Hi, this is Becky from More Than Borderline, and today I'm talking about depression and its co-occurrence with borderline personality disorder. According to Wikipedia, people with BPD are more likely than people with other personality disorders to have a mood disorder. Depression, bipolar disorder, those are just two examples of mood disorders. So it couldn't hurt to know the symptoms of either. Mania you can look up online, but I'm going to focus more on depression. Now, depression is more than just feeling the blues. It's more than just a reaction to a sad event in your life. Depression is a chemical imbalance in your brain that causes your mood to be affected. It's a physical illness that manifests with psychological symptoms. So you may ask, what are the symptoms of depression? Symptoms include feeling sad, hopeless, irritable, or just not yourself. Another symptom is taking little interest or pleasure in things you used to enjoy. The fancy word for this is anhedonia, meaning no pleasure. You may have trouble falling asleep or staying asleep. I've had that my whole life. Or you may be sleeping too much. That tends to happen when I'm first hospitalized. I tend to sleep way too much, and that's a symptom of depression. You might feel tired or have little energy. Fatigue is a common symptom of depression. You might have a poor appetite, or conversely, you might overeat. It could be a comfort food can literally become comforting food. You may have trouble concentrating. You may isolate, not want to be around people, which is one of the worst things you can do, because other people can recognize the symptoms and help you realize when you don't realize yourself, hey, something may be wrong here. You may move or speak so slowly that other people notice, or conversely, you may feel so restless that you move around a lot more than usual. And finally, you may feel bad about yourself. You may think that you're a failure, or that you've let yourself down, or you've let others down. That's a warning sign of depression. In the worst case scenario, you may have thoughts about death or suicide. These should always be taken seriously because while a symptom of depression, they are not normal. This is not a healthy symptom for real life. And you should always consult with your doctor or psychiatrist if you have thoughts of death or suicide. So those are the symptoms of depression. You may ask, what brings on depression? You don't always know. A family history, an unhappy life event, certain personality traits or patterns of thinking, or long-term use of some medications and alcohol or drug abuse can all cause depression. But whatever the cause, the result is the same. It's a chemical imbalance in the brain that causes you to feel depressed and have those symptoms. Now, how is depression diagnosed? Doctors use different tools to diagnose depression. They use questionnaires, medical history, physical exams to rule out organic causes, and compare it with the diagnostic criteria of the DSM-4. You should talk to your doctor if you think you have depression and describe your symptoms. Remember, there is help out there, and it is possible to get better.